Welcome to the Plastic Surgery Case Files, where we show you what goes on behind the scenes even before your surgeon scrubs in.
This is another case that we commonly see in our practice.
Absolutely.
You know, a young lady who comes in, finished having her kids, unhappy with her body, and interestingly enough, she's seen multiple plastic surgeons, and we're her third opinion. And unfortunately, the first two opinions she got were completely different. And she comes in to see us, and she's 32, and she's like, "Doc, I want a flat belly, and I just want to restore back what I had before kids in my breast area." So the common mommy makeover situation. So what is your approach? What do you tell these individuals when they come in and see you in your office?
Well, we obviously, with the experience that we have, can look at them and know immediately where some of their trouble issues are, but I think it's really important for us to help them articulate what it is that they're bothered the most by. And I would assume this patient mentioned her breasts, and obviously she's got ptosis, she's got a little bit of deflation. She's not completely deflated so that she has to have an implant if she's looking just for a little modest improvement in tightening. But certainly I want to know, what's your perspective on the patient's part of her breast volume? Does she want to enhance that or not? Is she happy with it and just wants to have things tightened up? And then, of course, you want to look them all over, do a complete examination on her abdomen, look for prior scars and things like that. But she obviously has diastasis of her rectus muscle. She's got some skin excess. I can't really tell from the picture whether she's got much in the way of extra fat, but she looks like the typical stretched, pregnant belly. So definitely have some ideas for her, depending upon, again, what she's trying to improve. So, getting back to her breasts, certainly, she needs more upper pole fullness. And through the years, we've transitioned from that, overblown, full, big, round implant look to help solve that problem to more modest size implants and sometimes simply augmenting the breast volume with some fat. And she might be one of the candidates. I would probably use an implant in her just because I think that would overall improve the appearance and the perkiness of her breast. But she certainly could consider doing some fat in the upper pole of the breast and doing a mastopexy.
We have the same philosophy in regards to that. This young lady came in thinking that she was going to get away with a mini tummy tuck, and in my eyes, there's three variables in doing a tummy tuck. The length of the incision, what you're going to end up doing to the muscles, and whether or not they ended up needing liposuction or not. I didn't do any liposuction in this case, and then ultimately just did a full plication. I'd love to hear your perspective on this. A lot of times, people will just sew the muscles back together, but that in itself will not really fix the problem that they ultimately have. And even just putting the muscles back together can still create a small bulge in that area. And a lot of times we really aggressively sew those muscles together or even overlap those muscles to really create that nice contour and then flat abdomen.
Well, to that end, I don't know if you use quill suture for your plication, but I've personally found that to be such a easier way to really reapproximate those tissues, and the overlapping sutures that you mentioned are really very rewarding for me to put in because it's such a robust repair of all that. But definitely I agree with you, the extent of her muscle gap, the fact that she's got enough laxity around the belly button there means a mini tummy tuck to me would be a disappointment for her and personally for me. And again, that gets back to managing expectations, right? Because if you think, I can make some improvement with this doing a mini tummy tuck, and her expectation is what we know the result of a full tummy tuck would be, then you're gonna make her unhappy.
One of the questions I always get asked: can these procedures be done all together, and is it commonly done?
Yeah.
And what's your thoughts on length of time in surgery and what can safely be done at one surgical intervention?
Well, the shorter's better, right? I mean, I was surprised to read not too long ago, and I think it was a couple of months ago in ASJ, our medical journal, that anything over an hour and a half, the infection rate starts to climb. And I've always sort of operated on, it's maybe that 6-hour mark where we're really starting to get into a big bump in risk there. But the shorter the better, but at the same time, the convenience and the recovery all rolled into one. We definitely want to do that for the patient's benefit. And these type of things we commonly do all the time very safely.
Thank you very much.
Good results.
Thank you.
For more peeks behind the scenes of other plastic surgery cases, keep coming back to theplasticsurgerychannel.com.